If you have hip pain and you've been told that you have hip dysplasia and that the shallow sockets in your pelvis are responsible for your hip pain and the future risk of hip arthritis, then you're going to want to watch through to the end of this video, because in this video, I'm going to go through the research on hip dysplasia, how it relates to hip arthritis, and how hip surgery for hip dysplasia actually stacks up in the long run. We're going to look at the long-term research on the most popular surgical treatment for hip dysplasia, known as PAO, or periacetabular osteotomy, and we're going to look at where some of the myths that currently pervade the medical community come from so that you can make smarter decisions about how you try to fix your hip pain. So if you're ready, let's get ready to think right, move right, and feel right. So first, let's talk about what hip dysplasia is. It is when your hip socket, this little area that your femur fits into, is considered too shallow. So rather than having a deep bowl for the femur to actually sit in, you have a shallower little dish that the femur goes into. And orthopedic surgeons believe that that flatter dish is responsible for hip pain and the development of hip arthritis. Now, this is an interesting theory that actually is not very old and hasn't really been tested that well up until recently. And you'll see the results of those tests later in this video. Now, how common is hip dysplasia? Well, it's actually really common in people without any symptoms at all. So this is a key fact to keep in mind as we examine hip dysplasia and hip pain. So a paper published in 2010 from Denmark showed that 4.3% of men and 3.6% of women with no symptoms, meaning no pain, no nothing, have hip dysplasia. A larger systematic review published in 2024 showed 3.8% in females and 2.7% in males. In 19-year-old Norwegians, the prevalence ranges from 1.7 to 20%, depending on how the researchers defined dysplasia, and that's from a 2013 study. In Asian populations, asymptomatic hip dysplasia seems to be more prevalent. So a Korean study showed a prevalence of 12.8 to 15%, depending again on which metrics you use to identify hip dysplasia. Just to point this out, there are different parameters that they use when they do x-rays, MRIs, and whatever, and they can define dysplasia using different measurements. So depending on the measurements, you might include some people's hips and exclude some other people's. So that's why there's a range of percentages in these studies. And finally, in a Japanese study on the elderly, nearly 30% had hip dysplasia. And this is very, very important. There was no correlation to hip osteoarthritis, meaning they had hip dysplasia the whole time and they did not end up developing hip osteoarthritis. So let's talk about the relationship between hip dysplasia, hip pain, and hip osteoarthritis. Are you ready to blow some minds? Yeah, buddy. It's important to note that a lot of people have hip dysplasia bone shapes, but don't have symptoms at all. In fact, if there were a strong correlation between dysplasia and hip pain, we would expect to see a much higher rate of hip pain and osteoarthritis in Asian populations. But that's not the case. So you have to ask yourself, is there some way to tell whether your hip dysplasia is related to the hip pain you're experiencing? The short answer to that is no. There are no definitive tests to determine whether your hip pain is coming from your bone shapes. You can't do a certain movement and say, oh, if that hurts, that's because of your bone shape. There have been no tests that show any correlation between x-rays, meaning what you see in terms of bone shapes, movement dysfunction, and hip pain. The Fader, the Faber test, the Stinchfield test, the Thomas test, none of them actually show any reliability for determining what the cause of your hip pain is. The only thing anyone can do is offer you a guess, and surgeons and physicians are often trained to just see dysplasia as the cause of hip pain, but as you can see by the prevalence rates, there just isn't enough evidence to make a convincing case. If you can have hip dysplasia bone shapes for your entire adult life, all the way until your old age, and not develop hip pain and not develop symptoms of hip osteoarthritis, then what are we looking at here?
Wait, let's talk about osteoarthritis more.
Okay, so surgeons often claim that hip dysplasia will lead to hip pain and hip osteoarthritis. And for example, there's a 2004 paper that claims there's a strong correlation between hip dysplasia and the development of hip arthritis. However, there's more recent evidence that this simply isn't true. A 2005 study examined the relationship between dysplasia, joint space width, and hip pain, and they followed volunteers with dysplasia and a control group for 10 years. And in the study, they found no significant differences in the reduction of the joint space width at follow-up between subjects with dysplasia and the control subjects, nor in self-reported pain in the hip. So to make that more clear, they followed two groups of people for 10 years, and when they compared the two groups, they found that there was no difference in joint space, meaning like how much space is between the bones here, or in the amount of hip pain people reported, meaning there was just no difference. The dysplasia did not correlate to joint space problems. It didn't correlate to hip pain. Also in that Denmark study I mentioned earlier, they found that acetabular dysplasia and the subject's sex were not found to be significant risk factors for the development of hip osteoarthritis. Again, pointing out dysplasia and arthritis don't seem to be linked. And in a landmark study published in 2016 done on senior-aged athletes, this was an award-winning study on hip health. Researchers found no link between hip dysplasia and hip osteoarthritis. And quoting from the study, radiographic findings of hip dysplasia or adult developmental hip dysplasia were not predictive of osteoarthritis. And they're studying, again, senior age athletes. So the key points here are that hip dysplasia is super common in people with absolutely no symptoms, and studies show that hip dysplasia is not a risk factor for developing osteoarthritis or for joint space narrowing, even into your older years.
Let's talk about the surgery now.
All right, so if you've been told you have hip dysplasia, you've most likely been recommended periacetabular osteotomy, or PAO, as this is the most popular surgical treatment. Now, you should know some background about PAO before you commit to doing it. So PAO, or periacetabular osteotomy, was first invented in, you might be thinking, 100 years ago, or maybe 70 years ago, or 50 years ago, and you would be wrong. PAO was first invented in 1984 by Dr. Reinhold Ganz, who, by the way, is the one who also invented surgeries to allegedly fix hip impingement. He and his team published a paper on this new surgical technique in 1987, and this launched a whole new field of hip surgeries. So just to be clear, this surgery was invented in my lifetime and was popularized within a very short period of time with minimal research, but the research is catching up. So with little science to back their claims, they popularized the belief that periacetabular osteotomy could prevent hip pain and arthritis. So if you do this surgery, you won't get arthritis, but also if you have hip dysplasia, now we know you also won't get arthritis. So not sure what we want to think about that. When we look at the results of the first round of patients who underwent PAO for hip dysplasia, it's clear that there's something wrong with the theory and the surgery, and we'll dive into that in a second. But first, I want you to understand what PAO even means. So PAO is an extremely invasive procedure. The surgeon makes giant cuts to create sections of your pelvis. So they basically cut all of this, just saw all of that, and then they shift it all so that the socket is kind of oriented a little bit more down, so that the femur is going up into this reoriented bone. And then they secure all that with these giant screws that go through your big pelvic bone and keep everything in that new position. And when you see images and pictures and videos of this, it's ghastly. But how horrible it looks aside, you might be wondering, is it going to give you full function and a pain-free life if you do it? And a 2024 paper actually analyzed the data from 62 studies on surgery for hip dysplasia, and the researchers sorted through decades of papers to find the highest quality evidence possible, which is hard in orthopedic surgery because a lot of the studies are not high quality. So they looked through all these studies and they tried to determine what actually has good evidence, what has bad evidence. And basically, if they had good evidence for a conclusion, they would rate their recommendations high. If the evidence wasn't great, they'd rate it low or very low. And so there are two important highlights in this analysis for surgery for hip dysplasia. First, the claim that surgery is very helpful for hip dysplasia is not supported by high quality evidence. They actually say the improvements found across all subgroups from pre to post PAO surgery provide low level certainty that pain, activities of daily living, quality of life, sport and recreation, and symptoms improve following surgery. Despite the large magnitude of effect found, risk of bias of studies and inconsistency in data means that they use this term grade for grading things. They said that grade certainty rating remains low. In other words, the evidence that the PAO surgery helps if you have hip dysplasia is pretty poor. There are strong claims of big effects, but there's a high risk of bias in the studies, so they can't really be sure that that's the case. And don't worry, we're going to come back to this point in a second because there's another study that helps us really understand what's going on. Now, the second major point to note from this study is that patients do not regain full pain-free function from PAO. This is from the conclusion in the study. They said patients do improve following PAO surgery and maintain this improvement, but they do not get to the same level as the healthy participants in the study. In other words, with the evidence available, patients who undergo periacetabular osteotomy do not get back to normal levels of hip function. Even in studies that strongly support periacetabular osteotomy for hip dysplasia, you see similar results. The only difference is they engage in really strange tricks to make surgery seem better than it is. For example, in a 2020 paper on PAO, researchers claimed that the majority of the patients have no or low pain. The operation is effective with a good clinical outcome. But when you dig deeper, you see that they've done something very sneaky to bias the whole paper in favor of surgery. And I encourage you to look at the link that I'm going to have in the description box to an article with a bunch of the research that I talk about in this video, because it'll be a little easier to see what's going on here. But basically, they use something called HOOS, which is the Hip Disability and Osteoarthritis Outcome Score, which they basically use to determine whether or not a patient's feeling better and whether the surgery that they're testing is actually working. So they ask patients a bunch of questions and then they add up all their answers to get a total score. So in this study, in the abstract, they say at the 2-year follow-up, the HOOS or HOOS pain score improved by a mean of 26 points, and a HOOS pain score of greater than 50 was observed in 86%. So you need to pay very close attention here because they're saying that the overwhelming majority of patients had an HOOS pain score above 50. That sounds fantastic, right? It sounds great. Okay, well, the majority of patients had a pain score over 50. It only sounds good if you don't know that the best possible score is 100. So you can look at the HOOS score yourself, and you can go to the link that I'll have in the description box, or you can just Google for the HOOS score, and you can play with the questionnaire yourself, and you'll see that a score of 50 means you still have a moderate level of pain. It doesn't mean you're pain-free. It doesn't mean you have a low level of pain. It means you still have a moderate level of pain. You're like right in the middle in terms of experiencing pain. So if you had periacetabular osteotomy and you still had a moderate level of pain, would you consider that a success? Because the surgeons, the researchers in this study who are pushing periacetabular osteotomy are saying, hey, the majority of people got better because their pain level was still moderate. They still had a regular amount of pain that they had to worry about. So buried deeper in this paper, they play an even dirtier trick. They say at 2 years follow-up, 86% of the preserved hips had no pain or a low pain score defined by HOOS pain of greater than 50. So did you see what they did there? So basically, it's the same trick. They lumped no pain and low pain together and defined that one group as a pain score greater than 50, but as we know, 50 is not no pain, and it's not even low pain. It's medium pain. But they redefined no pain and low pain to mean medium pain. And then they said, hey, 86% of people had low or no pain. Okay, so in that study, you can see PAO is not a guarantee you'll get full function back. And it's definitely not a guarantee you'll be pain-free. In fact, most likely you'll still have a medium level of pain. We need to move on to the next question.
Yeah, let's talk about hip pain and osteoarthritis again.
We did kind of cover this, but we should cover this more in detail.
Details matter.
All right, we're not just going to talk about arthritis. We kind of covered that earlier, right? But we are going to talk about how periacetabular osteotomy does or maybe does not prevent future hip pain and osteoarthritis. Because PAO is often suggested as a good means to prevent future hip deterioration, some surgeons say it's a great idea to do on young patients in their teens because they'll have better survivability or whatever, they can recover from the surgery better. But what are the long-term consequences? Will a surgery on a teenager to fix dysplasia mean they'll be pain-free and problem-free for life? Unfortunately, the answer seems to be a resounding no. A paper published in 2017 showed disturbing outcomes over a 30-year time frame. So they showed that 30 years after a surgery, more than 70% of the patients will develop progressive osteoarthritis, pain, and or undergo total hip arthroplasty/hip replacement. So in the study, they say after the improvement of clinical scores at 10-year follow-up, both the different types of scoring methods they used decreased to the preoperative values at 30 years follow-up. So across 30 years, the surgery basically did not give you long-lasting hip pain relief. It might have given you maybe 10 years, but then things just deteriorate and then more than half of you are going to end up getting a hip replacement anyway. So yes, you might get some improvement in that first 10 years, but by the 30-year mark, you're basically back where you were. And this is despite the fact that the surgery does actually successfully reduce your range of motion, which is kind of the argument for doing the surgery. Quoting from the study, typically excessive range of motion in dysplasic hips is decreased to a normal level after PAO. So again, they reduced your range of motion. If reducing the range of motion is supposed to fix the hip pain and you successfully reduce the range of motion, but it doesn't remove the hip pain and it doesn't prevent you from needing to get another hip surgery, then the surgery doesn't seem to be delivering on what it's supposed to do. That means PAO does not prevent hip arthritis, it doesn't prevent hip pain or hip degradation in any reliable way.
So can you fix hip pain without surgery?
Short answer is yes. I've seen it with clients, I've seen it with online students and commenters on my YouTube channel. And Erica and Jacqueline are two great success stories that I will link to their videos down in the description box. You should watch their videos so you understand how they beat their hip dysplasia. One thing I want you to know is it's not necessarily going to be super easy, but it's probably a lot easier than having your pelvis sawed into multiple sections and then bolted together and being unable to walk for long periods of time, which is just going to lead to atrophy in all the muscles in your entire body since you'll be stuck, unable to move. The hardest step in fixing your hip pain without surgery is to make a big mental shift. So instead of fixating on the orthopedic diagnosis of hip dysplasia, you need to focus on your muscles. You need to ATM, always think muscles. Instead of searching for the surgeon who has the most experience doing PAOs, you want to take responsibility for healing yourself. And you have to believe you can fix yourself, which is why I'm making this video. This starts with understanding a few concepts. First of all, your muscles move your bones. So if your bones are not moving right, if your muscles don't function right, you don't feel right. Okay, so if you feel like your hip joint is unstable, it's not just a function of, well, how flat is the socket? If that were the case, your shoulder would dislocate all the time. You would not be able to use your arm because that shallow socket doesn't provide enough stability. When you go and do a handstand or you do some sort of bear crawl, you are relying on muscles to keep the bones in the right relationship to each other. When you're standing, it's the muscles that are holding your shoulder joint in place and giving you the stability you need and the flexibility to do what you want to do. The same is true with the hip joint. You can't just obsess about the shapes of bones because you can't change the bone shapes anyway. The best you can do is saw through this thing and then reorient it, and that clearly doesn't work the way you want it to either. So keep in mind that by retraining your muscles, you can make daily life more comfortable and improve your overall function. As you learn how to train your muscles, the results become more and more clear on a daily, weekly, and monthly basis.
What about side effects?
There are no nasty side effects to exercise beyond some soreness and weak muscles, and maybe if you overdo an exercise or you choose the wrong exercises, you might be in a little bit of pain for a couple days, maybe in a worst case scenario, a couple weeks. But you're not on bed rest for months, and you don't subject your whole body to a barbaric surgery where you're cutting parts of your pelvis into sections. There is no debate that exercise can improve muscle function and size. There is no debate that you can change the way muscles interact to move your bones. That's why we practice movements. That's why dancers rehearse. That's why martial artists practice their moves. That's why people who play sports like hockey or soccer or baseball consistently, repetitively practice certain motions so that the muscles and the brain get good at producing solid, well-coordinated movement patterns. If you have unstable hips, it's because the muscles don't know how to stabilize the bones that make up the hip joint. The muscles that cover the hip joint, that go down into the leg, the muscles that control the pelvis, that go up into your core, into your torso, those all need to know how to fire, with how much force to fire, and at what time, in what configuration to keep things feeling good. If all you're doing is stretching all the time, if all you're doing is sitting on a chair and then doing relaxation work to try to get rid of your pain, you're probably training your muscles to get weaker and weaker, which is going to make you less stable. The main point here is that if you strengthen the muscles around your hips, you'll probably feel more capable, confident, and stable in the long run. In my totally non-medical opinion, going for a surgery that has demonstrated poor outcomes in the long run is not a great idea and should be an absolute last resort. You might rightfully be wondering, what exercises can I do to fix hip dysplasia if I'm really going to address the muscular component of my hip pain? And the answer is there are a bunch of hip exercises that you've probably never done and that you should do. The key here is to start experimenting. I'm going to link to a workout that'll help you with hip instability. I'll link to a couple workouts that'll help you strengthen your hip muscles and your core muscles. They'll all be in the description box down below, and I'll link to a couple at the end of this video. Remember that atrophy aches. Build strength over time, gradually. Don't overdo it. Just gradually build that strength, and you're gonna notice, hey, I think my hips, they're starting to feel better. Please use the free videos that I linked to, and if you're looking for a more detailed program with a lot more workout and exercise options and a practical schedule for adults who have responsibilities and real lives, be sure to check out the Healthy Hips program at uprighthealth.com/DIY. It will help you rebuild your hips at home. If you learned something new from this video or you had a major revelation, please share what it was in the comment section down below. And if you'd like to support this channel, I always appreciate it when you use the thanks or join buttons on YouTube, or you can go to uprighthealth.com/donate to support me. For more free videos to help you with your hips, check these out here. Like, share, and subscribe. And as always, I hope you remember that pain sucks, life shouldn't.